Today, we're delighted to be joined by Brianna Hood and Amanda Hare, who are from Rune Labs. So after the presentation from Amanda and Brianna, we'll have a Q&A with the presenters. You can submit your questions throughout the presentation through the chat function. And then toward the end of the hour, we will come back and we will ask your questions. So please do feel free to use the chat function at any point in time if you have a question, and we will come back to them at the end of the hour and ask Brianna and Amanda to answer your questions. So with that, I would like to turn it over to Brianna and Amanda. Thank you guys for joining us today.
Of course.
Thank you.
Thank you so much for having us. So my name is Brianna. I am the clinical specialist at Rune Labs. I am also a doctor of physical therapy, a RSB, a Rock Steady boxing coach, as well as LSVT Big certified. And then Amanda, if you want to.
Yeah, I'm Amanda Hare. I'm the medical science liaison here at Rune Labs. And I'm also the clinical operations manager. Also a nurse practitioner, and just received a new certification in movement disorders for APP. So really excited about that, and really excited to be here with all of you. So we will go ahead and get started with our presentation.
So let me share my screen. Get this up here. And Amanda, you can see my screen?
Yeah, we're good to go.
All right, let's do it. Okay, so we are Rune Labs, and our product is StrivePD. So how this all came about, how this all came about is from Aura. This is Aura here. She has Parkinson's herself and was diagnosed in 2011. She had a lot of sensitivity and a lot of side effects from medication. So she was always tracking her symptoms on pieces of paper, on Excel sheets, all these notebooks, and bringing it to her appointments. But that got very burdensome to have to do that all the time. So she decided to create an app, StrivePD, to start to be able to log all of her symptoms and have everything in one place on her phone, to be able to easily bring to her clinicians and her care team. In 2018, we acquired the app StrivePD from Aura, but she does still sit on our Rune Labs patient advisory board. So we're always making sure that whenever we are going to release a new feature or create something new in the app, we go to our patient advisory board as well as some beta testers, and they're all people who are living with Parkinson's, because we want to know if this, is the right thing to be creating, if this works for them. So she is still on that board and helping us create the best app that we possibly can. So we keep calling it an app, but it's actually really, StrivePD is a care companion. So you can use this app to understand your symptoms. When paired with the Apple Watch, you also get some really great data about tremor and dyskinesia. We'll get a little bit more into that and how that works. The app, or the tremor and dyskinesia detection on the Apple Watch is FDA cleared, and our app is also HIPAA compliant as well. You can track your symptoms over time. You can see how things like medication or exercise affect your symptoms. And you can also see what clinical trials you could be eligible for. So that's kind of a new feature that we have, and Amanda's going to give a bit more information about that. And I should also say the StrivePD app is completely free. There's no in-app purchases. You can download it from the Apple App Store. You do have to have an iPhone. We do not work on Androids, but any iPhone, the iPhone SE, Generation 2 or newer, the app will work on. So again, you can automatically record your symptoms with the Apple Watch and the StrivePD app. You can learn from the patterns and behaviors, which could better manage your symptoms and see what makes them better, what makes them worse. We have a gentleman who he notices his tremor, which is detected by the Apple Watch, starts to get a lot higher every time his mother-in-law comes to town. So things like that, you can really see how it affects your stress and see how your tremor gets worse. Don't tell your mother-in-law that, but it was an interesting correlation he started to make. You can also improve your communication with your care team, enable them to view your symptoms and your data in one place. So the app will put all that data together and also email you once a month with all of that information. And we'll show you some pictures of what those reports look like. And they're super nice. You can download them, you can print them out, and you can bring them to your care team so that they can see what's going on as well. And also you can participate, like we said, in those clinical trials. If that's something that you're interested in, we will alert you about different clinical trials and if you're eligible for them. So here's a couple screenshots of what this app looks like on the iPhone. Again, it's only for use with the iPhone. And up there you can see it's the iPhone SE, second generation or later, and works with the Apple Watch Series 5 or later. So if you take a look at the middle screen here, you'll see tremor and dyskinesia. So the Apple Watch received that FDA clearance to passively track tremor and dyskinesia in people with Parkinson's. So just by wearing an Apple Watch, it will automatically happen and pull into StrivePD for you to be able to see. You'll get this really nice graph of your day and be able to see the peaks and valleys of that tremor and dyskinesia throughout the day. With this information, you'll be able to start to make some correlations between, oh, I took my medication at this time and I see my tremor starts to go down, but then I see it starts to peak up again right before my next dose is due. So you can start to see, maybe I need to talk to my doctor about shifting my dose a little bit earlier because it seems like I need to. Or maybe, I did exercise in the morning and I noticed that my tremor's a lot better in the evening, the days that I exercise. So you can start to really visualize this data. Whereas before you would go to your appointments and, your doctor says, hey, how's your tremor doing? And you say, I guess it's better, or I guess it's worse. This gives you objective measurements and a really nice bar chart to be able to show exactly how your symptoms are doing. It will also summarize the total amount for that day. You can see the day view. You can zoom out to a week, 2 weeks, a month, or 3 months, which is really nice as well. Let's say you started a new medication for improving your tremor, and you want to be able to see if that actually has made an improvement. You can zoom out 3 months ago and be able to see that change over time. We also have a really nice feature with activity that I'll get a bit more in detail about, and something that excites me because I'm a physical therapist, so we love activity, and we do know just how important that is for the Parkinson's population. So I was talking a lot about data, and you're probably wondering, well, where's this data coming from? We have 3 main buckets of where we pull this data from to create this nice information about your day-to-day and those nice reports that you get every month. So the first bucket there, labeled number 1, is the Apple Health Kit data. If you're familiar with Apple products, on your iPhone, you have something called the Health app that comes on every iPhone, and it is white with like a little pink heart on it. That has data like sleep, if you wear your Apple Watch when you sleep. We'll have mobility data, so how fast you're walking, how big your stride length is. And that actually comes from the iPhone, not from the watch. So just having your phone in your pocket will start to collect that data. Activity, so if you use your watch when you work out, it will automatically record your workouts and put that into StrivePD as well. And then recently, the heart rate metrics we started pulling in. So you can see how high your heart rate gets during exercise, which is a very important thing to know because certain zones of heart rate can have more improvements on your symptoms than others. And I'll get a little bit more into that as well. The second bucket of data that we get is from the Apple Movement Disorder Kit. So this is what got the FDA clearance. This is what tracks your tremor and dyskinesia. Again, that's from the watch, and it happens passively. You don't have to do anything except wear the watch. It will automatically sense if you're having tremor or dyskinesia and pull that information into StrivePD. We do say that you should wear the watch on the side that you have the most tremor or dyskinesia on in order to get the most accurate data. The last bucket we have there is the patient self-reported data. So this is anything that you manually input into the app. We do know that everybody has different symptoms. So if you're having headaches or constipation or something going on that you want to put into the app to start tracking, you can do that. And it's very simple, a few clicks. And we also have the ability for you to use Siri on your phone or on your watch in order to log things as well, because we know that some days it's tough to be manually inputting information into a phone. Buttons are small. Sometimes if your tremor is really acting up that day. So it is available with Siri as well. Oh, and I should also mention medication schedule. We do know that's very important. And also medication schedule can kind of get complex at times. So you can input your medication schedule into StrivePD. You just have to input it once. And then it will give you reminders either on the phone or on the watch to alert you when it's time to take your next medication based off of your schedule. Here's a couple more screenshots of what some of the parts of the app look like. Again, we trial all of this with our patient advisory board and with our beta testers to ensure that we're making it easy and low burden for you as a user. We know not everyone loves technology and not everyone feels comfortable with technology. So we try to create the most easy way to be able to input this information. Again, the tremor and dyskinesia data is completely passive. You just have to wear the watch. The mobility metrics, completely passive. You just have to have the phone in your pocket. But if you want to add that extra information to really give your clinicians more insight into what's going on, like headaches or stiffness, pain, anything like that, unfortunately, the watch can't pick those things up yet. Maybe in the future. So those things you do have to manually input, but you can do so very easily and very quickly. Here's a little bit of more information about the exercise and the activity section of our app. So we have this nice little activity card here. If you are exercising with the Apple Watch on, the exercise will automatically be pulled into StrivePD, so you don't have to log it. If you don't have an Apple Watch, though, you can go in and just log that you did an exercise and how long you did it for. It will put a nice little streak here. So how many days in a row that you have been exercising. People get very competitive with this. My rock steady boxers have competitions with who can get the most days in a row of their exercise. We also have weekly minutes, so you can keep track of how many minutes you're doing each week. The Parkinson's Foundation and the American College of Sports Medicine recommend at least 150 minutes of exercise per week. So we do have that as the goal, and you can track how close you're getting to that goal. And then again, you can look then at your tremor and dyskinesia data and see how exercise can improve your tremor over time. Again, exercise is just so important. I know everyone hears from their doctors all the time, you should exercise. We all know we should exercise, but specifically for people with Parkinson's, exercise can actually help to slow the progression of the disease. Even further, they've realized that the intensity of the exercise matters. So going for a leisurely walk is nice, and that's a great thing to do. But doing something that really gets you sweating and gets your heart rate up, like a rock steady boxing class, that is going to have more improvement on your symptoms and longer term than a leisurely walk. So with that, we've included heart rate metrics. You are supposed to do from that 150 minutes, you're supposed to do about 90 minutes in a moderate to vigorous heart rate zone. So we do calculate that heart rate zone for you. You don't have to do it. As long as you have the Apple Watch on, it will calculate and it will bring all of that data in to StrivePD, and you'll be able to see if you are hitting that heart rate zone that you should be hitting. So here's another picture of some of the heart rate zones. We call it the zone 3+ is where you should be for exercise, again, and to get that the most benefit out of your activity. So here you can see the minutes that this individual was in the different zones. This is all based off of your age and your heart rate max. So zone 3 here, they were in 38 minutes. And this was the beats per minute of their heart at that time. And then how much time during that activity that they were in that zone 3+ that we want to see you in for the most benefit. Lastly, is the StrivePD reports. So I touched on this a bit in the beginning. Every month, automatically, you get a report sent to your email. It's a PDF that you can forward to whoever you want, so your caregivers or your family. You can also forward it to your clinicians if they would like to see it. You can also print it out and bring it to your visits, bring it to your physical therapy visits, OT, speech, whatever person on your care team you would like to have this report. This report will summarize everything from the StrivePD app, so everything coming from the watch, as well as anything that you manually input into the app itself. It will compare the most recent month, the most recent 30 days, to the 30 days before, which is really nice. So you can see if you are improving maybe in your walking speed, or you some reason have more tremor this month, and you can see maybe why is that? Was I very stressed, or was this going on? Maybe you started a new medication last month, and now this month you're seeing all these improvements that are happening. So again, it's that objective data right in front of you where you can start to see how you're progressing along your Parkinson's journey. This report also, we utilize AI technology, and I know AI is like a buzzword right now when you listen to the news. But we do use a LLM, a large language model, which helps to synthesize all that data for you and give personal recommendations as well. And Amanda and myself, our clinician team, we check these to ensure that they are accurate. And we've gone through a very rigorous process with this. Here's a few more screenshots of what the data looks like on those reports for you to bring into your clinician team, or, just utilize yourself to be able to compare from month to month how you are doing. You'll see tremor and dyskinesia data. You'll see your activity and heart rate. You will see your mobility metrics, and you will see any kind of symptoms that you manually log into the app. All right, and now I'm going to turn it over to Amanda, who's going to go over a few other features of StrivePD.
Thank you, Bree. That was awesome. Great highlights. This is a great app. So going into the clinical trials that we touched on, this is something that is very near and dear to my heart when, outside of Rune, I am, talking with patients about clinical trial opportunities, especially so that we can get disease modifying therapies out there. We know that, we've been using carbidopa-levodopa for a long time, and that's still the gold standard, regardless of however many medications have come out. And clinical trials is really where we make progress. And so we want to make sure that you all are connected to clinical trials. And, potentially your clinician may not have access. So one of the things that I try to keep up with is, what is my academic center offering so that I can educate my patients on this? And we know that clinical trials constantly change. There's new clinical trials. There's ones that have already completed enrollment. They've gotten enough participants. They have all kinds of different inclusion, exclusion criteria. Some you can be on medications, some you cannot be on medications. Sometimes the date of diagnosis matters, and all that is very complicated. And for that reason, there are a lot of people who do not participate in clinical trials because they don't have that knowledge. So what Rune Labs and StrivePD has tried to do here is really get that access and knowledge directly to patients, regardless of if you're in a private practice, if you see a movement disorder neurologist, if you see a primary care physician. All of this is at your fingertips. So we really partner with clinical trials that are low burden, that are close to you. So travel is a big thing that deters people from participating in clinical trials. We want to make sure that you're compensated and that these are rigorously monitored by the IRB. That is the review board to make sure these are done very methodically. They're very standardized. And we will look at your StrivePD data and look to see if any of your symptoms that you've reported, any of the medications or lack of medications are there. And we will send you something in the app that lets you know that there is a clinical trial that you match with. And if you're interested, we will send you more information, and then we will connect you with that site that is closest to you so that you and that site coordinator can talk about what this clinical trial entails. And obviously, you're more than welcome to reach out to your clinician to let them know about this clinical trial and to see if this is something that would benefit you or to get their thoughts. So we want this knowledge to be in your hands. We want this to be very easy to use. Right now, there is a website called clinicaltrials.gov that, to be honest, I have sometimes difficulty navigating to find certain clinical trials. So we want to make this easy. We want to make this, something that can be right at your fingertips. And if it's something that you're interested in, we're happy to tell you more. And if you're not interested, no worries. That is completely up to you, but that is one benefit that you'll see within this app. We have a wide network. I'm very proud of this network. We have over 260 clinicians. A lot of them I've met on Zoom and really talked about the data, how it's collected. There's over 150 clinical sites that have used StrivePD or have talked to their patients about StrivePD. And we are now well over 11,000 StrivePD users, which is a big number for us, just getting started. So we know that this care companion can really reach more people. And we appreciate you all listening to us today because it is something that is a wonderful resource for free that collects a lot of data without you having to constantly interact with an app multiple times. So one of the reasons we decided to do a pilot was something that we found out through the Parkinson's Foundation. So we know that many people with Parkinson's will be hospitalized, 4 out of every 12. We know that when people do go to the ER, they do get hospitalized. There's a lot of things that may not go super well. One of them is, 3 out of 4 people won't get the right medication on time. So a lot of people are on, extended release versions of carbidopa-levodopa, like the new Crexon or Rytary. And sometimes these hospitals don't have that. And so they have to put you back on regular carbidopa-levodopa, and maybe that conversion isn't quite right. Or maybe you take that medicine at 8, 12, and 4, but they give it to you 3 times a day, at 9, 2, and 9. And we know that a lot of patients, 2 out of 3, will have complications related to that, medication, error. So we want to look at the challenges of managing Parkinson's patients in a hospital or ER setting. And we know that when you're in the hospital or you're in the ER, they want you to stay in bed. They actually even set alarms so that when you get out the bed, it goes off and everyone comes running in your room. So there's not enough opportunity for movement. And Bree just talked about how amazing exercise benefits this disease progression. And we know that when you're off your medication schedule, your symptoms are not well controlled. So even getting from the bed to the bathroom, if you're having off episodes or you're not, your medicine isn't at optimal dosing, you could have a fall even in the hospital. We know that certain medications in the ER and in the hospital are given that are actually contraindicated, meaning they should not be prescribed to Parkinson's patients. Those are sometimes administered. And so there is a temporary worsening of Parkinson's symptoms overall. And then, of course, the medication with getting missed doses or delayed doses, it can be quite challenging for a Parkinson's patient to get into the hospital. So I will talk about next. We did a pilot with Kaiser Permanente. Most of these are out of Northern California, but we really wanted to set a goal of improving patient and clinician care experience through the StrivePD Care Companion, where we coach and triage and have a whole management symptom around your Parkinson's symptoms. So what we did was we had patients and users log their medication, make sure medications were given on time, really getting that good exercise, and just optimizing your care plan that your clinician has given you. And through these high touch points and this very much white glove service, we found that 75% of patients reported StrivePD being very helpful in medication management. So a lot of patients can remember the first dose and the last dose, but that middle dose is just difficult. And if they don't take the middle dose on time, sometimes that next dose doesn't work as well. So 75% of people really had much better adherence to that medication regimen, which we know is so important. 74% reported increasing their activity after we onboarded them into this pilot. That is huge. We know people want to exercise and everyone wants to get on that bandwagon, but sometimes it's hard. And sometimes we don't know what exercises to do. So Stride PD can really get you a better understanding of where you are in your heart rate and where that max benefit is. So we were super excited about this result. 52% exercised more than 150 minutes a week. So we didn't ask them to do that. We set a goal and pretty competitive group of people. They really excelled and 52% went above that 150 minutes, which is amazing. 67% reported events which require attention. So we know that there are certain things like lightheadedness and dizziness that could, increase your risk of falls, or maybe a person had a fall and needed that attention where maybe they weren't doing so well and they saw their doctor and it turns out they had an infection, like a urinary tract infection. So a lot of this triage for symptoms that were reported in the app, increased tremor, increased dyskinesia, all of that was looked at, and we were able to reach out to patients with better education, reach out to their clinician to see if they needed a sooner appointment time. And that went very well. And then there were over 62,000 words that patients would use and users would use to just write notes, write summaries. Some people reported certain things that they would eat that would interfere with their medications, or maybe their medicines wouldn't work as well. Some people would have a hospitalization and they would document that in the app. And so we know that in between visits, however short or long, there's a lot to remember because every day changes. And so the use of having this free text where you could take these notes and know that every month they would be synthesized so that you would have some points to make sure that, yep, I'm going to highlight this, I'm going to bring it up the next time I talk with my doctor. So these were 139 patients. This study is still ongoing, but we looked at it about at 9 months, and these were the amazing results we saw. So save the best for last. Stride PD cut nearly ER visits in half, which was amazing. So we looked at people who last year had X amount of ER visits, and we tried to figure out, what are the most common things that would send a Parkinson's patient to the ER and how can we help? And so we knew that there were certain algorithms, like if your walking speed, if your step length, if your double support percentage went up or down, so your walking metrics changed, we knew that we needed to look into that. We knew that if you were missing medications or if you were reporting certain symptoms like hallucinations or off time, we really wanted to get in there and educate patients on why that might be happening. And so a lot of times, if you were having a new onset of hallucinations, we were able to send an educational video to look at, okay, did you start a new medicine? Because sometimes medications have side effects of hallucinations. Or do you think you might have an infection? Do you have any symptoms of a urinary tract infection? Or do you have any other issues, like maybe you have COVID or the flu, which has been going around a lot these days. And then we also looked at patients needing more visits. So of course, we know that movement disorder specialists, only 9% of patients see them, and so their time is very limited. So if our Care Companion tool could help people exercise, stay on their regimen, educate them more, did they really need a visit every 3 months, or could they go every 6 months? And so we did see a decrease in visits to their movement disorder specialist through all these great interventions and resources that we gave. So that got us really excited. And we said, well, what if you're not part of Kaiser? How do you get this wonderful benefit? We can't let all of this go without offering it to more people. So we came up with something called Strive Guardian. You can think of it like a guardian angel, where we really want smarter Parkinson's care. And so we took all of those results and pulled it into an individual subscription of sorts. So we really want StrivePD Guardian to be something that can help you manage these hard symptoms, with all of these tools, because it is hard. So we know that it can be overwhelming. No day is the same. A lot of times you can take your medication on time, you can eat the same thing, you can do the same exercises, and every day is different in terms of symptoms and how you feel. So these are very complex symptoms. There's complex medication schedules. And so we want to support you with StrivePD Guardian every step of that journey, because it forever changes. And so we know that we can really unlock this personalized guidance for you, because not everyone is the same. So StrivePD Guardian is a subscription-based service for $600 a year. And it is on the iPhone and Apple Watch, and it helps you really adopt these proven strategies that we've done in a pilot with Kaiser. And so what we want to do is pair you with a dedicated health coach and our FDA cleared technology to really give you insights into that unique journey. So you cannot treat or look at a Parkinson's patient and compare them to the next. We all know that everyone is individualized, and we can really support helping you make better decisions and bringing this unique journey to your clinician and being armed with more information, with real-time support, where you're on a Zoom call with someone who can kind of optimize your care plan with you, help you know how to track your medicines, prepare for a doctor's visit, and help you kind of stay ahead, which can be hard. So we would first onboard you with a live session. So a lot of times people can be overwhelmed, like, how do I use this app? What do I do? What do I need? What do I not need? What if I don't have tremor? Do I really need a watch? This is where we can tailor your onboarding and get your understanding of the app more beneficial to what your needs are. So once you're onboarded and you start using the app, we give you these coaching sessions where you're getting kind of expert suggestions and focused care on what your goals are and what your questions are, so that we can help you through that journey. And then, getting ready for your doctor's visit, really understanding what are the key concerns that the app is picking up, that you've reported in the app, and how can we help you talk to your clinician about that when you get in there. Because every time, I ask patients, how are you doing? They don't want to let me down. They don't want to tell me they're not doing well, or they don't want to sometimes say that they have more tremor because they think I'm going to prescribe more medication, or they think their disease is really progressing and things are getting worse. But we know there are a lot of things that certain medications can cause that do not have, that have kind of similar symptoms of progression. So really getting in there and helping you talk with your clinician to strategize that best care plan for you. And then again, monitoring these symptoms that may indicate that, okay, we might need to, bring this up or bring this to attention. There may need some extra care, directed towards hallucinations or lightheadedness or off time, so that we can keep you safe. So if you're interested in StrivePD, again, you can download this in the App Store on your iPhone. You can scan this QR code, or you can go to strivepd.com for more information. We also have a support email, support@runelabs.io, that you are more than welcome to ask questions. But we hope that all of you will download and try the app and see how it can help you in your journey to optimize your care.
Thank you guys so much for that presentation and letting us know more about StrivePD. There's so many options available for people. So I'm just, again, delighted that you are able to join us today. We got quite a few questions. So we're just take an opportunity to go through some of the questions from the audience. Again, if you have any other questions, please do add them into the chat function. We will try to get to all of them before we end in the next 25 minutes. So the first thing that was asked is, does StrivePD track leg tremors and internal tremors?
So I could take the leg tremor part because there is a slight limitation with the watch being worn on the wrist, and the FDA clearance is for it to be worn on the wrist. We have had people ask if it could be put on their ankle, and unfortunately, no, that is not what the validation study showed. So it will not most likely pick up leg tremor or tremor in your ankle or foot area just because of the distance from the watch to that area. So it is for that typical upper extremity tremor that is most often seen in Parkinson's. And again, we do say wear it on the side that you have that most tremor or dyskinesia on.
And remember, if you have tremor and you see that your watch is not picking it up, same with dyskinesia, you can log an item. So you can log that symptom so that you know that that is happening. Sometimes, if you have a head tremor, that's not going to get picked up. So make sure you log that. We all love Siri. So Siri helps us log things very quickly from our watch. That if you are a StrivePD Guardian member, we will teach you how to use Siri. She's super helpful. And as for the internal tremors, so I do often find that patients will tell me they feel this buzzing or this internal tremor that no one can see. And sometimes that can be an off symptom, meaning your medications are not in your system like you would like them to. So reporting that as, in your notes that you feel this internal tremor, or reporting that as a symptom, very quickly, 2 seconds, Siri log internal tremor and StrivePD. All of that can be done super quick so that you have a documentation of, let's pair that with when you take your medicine versus when that symptom happens, so that when you do see your clinician, if that is a wearing off symptom, your medication can be adjusted.
So if you have an Apple Watch and you have a tremor in an arm, that's going to get picked up automatically. If you are using, if you don't have a watch, or if you're getting an internal tremor or a tremor somewhere that isn't in an upper extremity, you can always log it yourself. And you can use Siri to do that.
Yes.
Okay, awesome. So can you use an iPad?
Yes.
Yes, you can download StrivePD onto an iPad and use the application on the iPad. The limitation with that is an iPad cannot connect to an Apple Watch. So you do need an iPhone to have an Apple Watch, which picks up the tremor and the dyskinesia data. The other downfall of using the iPad, the iPhone is what tracks your mobility metrics. So your walking speed, your step length, your double support time, all of that mobility and walking and data comes from the phone. So we do encourage you to put the phone in your pocket when you walk around. I don't think you can put the iPad in your pocket to walk around with it. And I don't believe it would pick up the gait metrics anyway. So yes, you can use the iPad to just manually input data if you would like, and log those symptoms manually. But the iPhone and Apple Watch give you a lot more benefit.
Okay.
Yeah.
So while we're on
it's a bigger screen. So if you're looking for data and trends and you want to see it on a bigger screen, you can definitely use it for those things as well, which I find to be much more user-friendly.
So while we're on the topic of devices, someone did ask about the Android. So any plans to have the app available?
Not right now.
Okay.
We do get
Okay.
that a lot. And, it just depends on the algorithms that we use in the watch that is owned by Apple. So that's where, the validation comes in. So Android is a whole different system. And so for the time being, we are only Apple.
Okay, well, thank you for that. So Claudia is asking about when to wear her Apple Watch. She only wears it while she exercises. Is that okay? Will she get the same benefit?
We do encourage you to wear the Apple Watch at least 6 hours a day. That way you can see your trends of your tremor and dyskinesia data. We also encourage you to wear it at night when you sleep. I know some people don't like wearing things when they sleep, and understandable, you don't have to, but you will get that really great sleep data as well to see how often you wake up through the night. So just wearing it for exercise is a great start. But if you really want to start to see trends and be able to correlate your symptoms to your exercise or to your medication schedule, you should wear it at least 6 hours a day.
Okay,
And
6 hours a day.
yeah, and I always encourage my patients, sometimes they're like, I just need a break from the watch. What I encourage people to do, and you can ask your clinician this as well, is I would like them to wear it at least 2 weeks for 6 to 8 hours a day before they come to see me. And then I want them to wear it at least 2 weeks after I see them so that we can look to see if there's been any med changes, or maybe you did some rock steady boxing classes or you did LSVT big. That way we can compare before we made an intervention or changed something and after, and then before you see me again, 2 more weeks. So if you're really not a watch wearer, we really try to get that good data for your clinician. Of course, we want you to wear the watch every day, all day, but if it's really coming to picking and choosing specific times, I think those could be very beneficial.
So we have a couple of very specific exercise questions that I'm hopefully we can answer for everyone today. The first one was talking about that zone 3+. So I think, Brianna, what you told us was recommendation for aerobic exercise 150 minutes a week. 90 minutes of that should be zone 3+. Was that about?
So 150 minutes of just any exercise. So it doesn't have to
Okay.
be aerobic. It can be
Okay.
flexibility, balance, strength training is very important. Don't forget about lifting some weight
Okay.
in there. But 90 minutes of the 150 should be vigorous to moderate exercise. So that's about 70% or more of your heart rate max. And so we want 90 minutes a week in that zone. And I did see someone said
Yeah.
that they're exercising for about 60 minutes, and what percentage of that 60 minutes should be in that zone 3+. It's a great question. And that really depends, because it depends what activity you're doing. So some of my rock steady boxing classes, individuals are in that zone 3+ for 75% of the time because it's a really intense class. Where other times that class is maybe a little bit more low key and we're doing more flexibility or we're doing more balance, and your heart rate's not going to get up as high during that time, but that doesn't mean the exercise isn't important and that you shouldn't, be doing that. So I wouldn't say thinking about it as a one exercise, what percentage should I be? I would think of it in a broader, spectrum of, in that week, did you hit 90 minutes in that zone? And again, you'll see that in the app. It will tell you your progress of that 90 minutes if you're reaching that for that week. So that's how I would look at it. You can, of course, always see which exercises get you into the zone the most based off of the percentages. So if you're, 2 more days are left in the week and you still got to do 20 more minutes of that, 90 minutes, you can see what exercise is going to get you there.
That's a great way of looking at it. So you're looking across the week, you're making sure 90 minutes of that 150 was in that zone 3+. So you're trying to hit moderate or vigorous for about 90 minutes a week. So if you get that in a 75-minute rock steady boxing class, fantastic. If you don't, then you can split it up across the whole week if that's easier for you as well. Okay, awesome. Thank you for that clarification. I also had somebody asked us about specifically, how does exercise help to slow Parkinson's, and do endorphins have a beneficial impact on PD?
That's a great question. So endorphins are great, absolutely. But when you hit that heart rate zone that you should be hitting, something called BDNF is released in the brain. That stands for brain-derived neurotrophic factor. So that is released in the brain during that time. That BDNF can help with something called neuroplasticity in the brain. So that's the ability of the brain to be able to create new connections, new synapses, improve the speed of different interactions in the brain. BDNF can also help to slow down some plaque that gets built up in the brain, specifically in the Parkinson's brain, certain proteins that are in there. So it really just helps to clean up some of the areas of the brain and to speed up some areas of the brain, which in turn would then improve certain motor functions. So it would improve your walking speed. It would improve your ability to move and that bradykinesia that you sometimes will experience, or rigidity that you'll sometimes experience from Parkinson's. So yes, it's similar to an endorphin. Another thing that is released, which is part of the endorphin group, is dopamine. So we know that dopamine is already lacking in the brain for those who have Parkinson's. So yes, when you exercise, it naturally releases more dopamine and also helps with that connection in the brain and synthesis of dopamine.
Fantastic. Jill is asking about dyskinesia and what it is.
Yeah, that's a good question. And that's what we found that this care companion tool through StrivePD can really help you detect. So tremor is very rhythmic, meaning that, it's kind of at the same speed. It's, very much kind of steady and rhythmic. Dyskinesia is more dancey, fidgety, wiggly. So it's these involuntary movements that happen usually as a side effect of the dopamine that you're taking, the carbidopa levodopa, where your medicine is nice and in your system, and one of those side effects is dyskinesia. So one of the examples that we use is Michael J. Fox. When you look at him and he's giving an interview, he's kind of fidgety, wiggling, maybe his head is bobbing. Sometimes people's foot kind of turn and twist, and it's this dancey, non-rhythmic movement. It's not like tremor. And it usually happens anywhere between 30 minutes to an hour after your medications are, administered, because it is a big side effect of levodopa.
She's also asking about comorbid conditions. Can StrivePD also take into account if you have another health condition in addition to Parkinson's?
It's a great question. I mean, you can use it. It's a toolbox, right? So, you can use as many tools at once as you would like. Of course, your heart doctor would love for you to have more exercise. Maybe your heart doctor wants you to keep track of your blood pressures. Those are absolutely very easy to do in StrivePD. And, printing out that report to take it to other doctors is great. We are, in this as for Parkinson's, but you are more than welcome to use it to track other things. And we see a lot of people do, if they are having shortness of breath, or, maybe their primary care doctor has asked them to check their blood sugars. It's hard when you have to write it down on a piece of paper. You get to the doctor and you realize, oh, I forgot to bring my notebook. If all of that is in your app that you can pull up in your doctor's office, then you've got all your notes right there. So you use it to your heart's desire.
We're also being asked, do you know, is StrivePD Guardian covered by any health insurance networks? Do you work with any health insurance networks?
Not at this time, though this is a goal of ours and something we are actively working on. One of the reasons we did do the pilot with Kaiser Permanente was also because we are trying to prove how much can be saved money-wise with insurance companies, and also for the patients themselves and the hospital systems by use of StrivePD. So we're hoping as we continue to do these pilots, and we have a few lined up for the future as well, that we can show the benefit to insurance companies, and that they will then help to cover this cost for individuals, or maybe cover the cost of an Apple Watch. And the Apple Watch is really great. And I also like to make a disclaimer that I know we talk a lot about the Apple Watch. We do not get anything from Apple. We are not selling you the Apple Watch, unfortunately. I wish we did. because lots of people have gotten the Apple Watch strictly to use with StrivePD. But no, we do not have any financial ties with Apple right now. But the use of the Apple Watch, not just for Parkinson's, but for fall detection, for some people are utilizing it for the heart rate and the ECG and the AFib detection on it. It's a really, really great tool, and they keep breaking into this healthcare space. They're now looking into ways to use it for diabetics, for looking at blood sugars as well. So, we do hope that because of all of this, that insurance will start to cover these devices, and also our StrivePD services. So fingers crossed for the future that they will see the value in this.
Yeah, and I really encourage my patients too, if they are looking into a life alert. Of course, an Apple Watch, if you're fall in the bathroom, you can always call your, daughter or your care partner. That is an avenue for you to call 911. And I know some services through insurance are covered with life alert and things like that. So we are really moving and shaking in this, insurance realm, because we feel it's very important that all patients have this service.
Thank you for that. Does the StrivePD app also track blood pressure? Tom has trouble with low blood pressure. A lot of people with Parkinson's have trouble with low blood pressure. So is that something it can track?
Not right now. I know there are apps out there that advertise that it can track blood pressure. StrivePD, specifically does not, but there is an area in that notes section where you can log your sitting and then your standing blood pressure, because we know blood pressure can drop when you stand up. When you have Parkinson's, which can cause lightheadedness and falls and making you off balance. So right now it does not, but you can log your blood pressures in the notes section of the app if you would like.
Is the app and its complete functionality available in Canada?
Yes, I believe recently, correct, Amanda? Yes. It used to be just the United States, but now we have opened that up to Canada, correct?
And regarding the version of the Apple Watch, do you need to have a specific version to have StrivePD?
Yes, the Apple Watch 5 or more recent. And I think we're up to almost like 13 different generations of the Apple Watch. The 5 is a pretty old one that still works in full functionality with StrivePD.
Well, we have a lot of people who are super interested in the app, including our Android users, one is asking us, you can still have the app, right? You just can't get the same sort of passive information, or no, it's just not available on Android.
Not available because you only download it through the Apple App Store, which I believe you cannot access that unless you have an Apple device.
I will say that some of our users have gotten an iPhone that only has internet service. They may not have cellular service on there, so that they can have, they have two phones. One is their Android that they use for calls, and one is the iPhone for StrivePD. We understand that is another financial cost, but some people are doing it that way, and then some people are also switching from Android to Apple. Not that we get any commission off of that.
Yeah, just one more time. None of us is benefiting from Apple or Apple Watch. Nope. Yeah, thank you guys for that. I think we already answered this question. Should your watch be worn on the arm you have tremors, or does it matter?
Yes, for the most accurate measurement, wear on the side that you have the most symptoms. Yes. Mm-hmm.
And then for the StrivePD Guardian, what kind of provider will be the health coach or the agent helping them?
It's a great question. So we have certified health coaches who will be having these coaching sessions. Amanda and I also have met with them to educate them as well on different topics. I will say that we are not practicing medicine. We are not giving medical advice with these coaching sessions. We are not working under our license. And that's for various reasons. We have to be licensed per state. And when it comes to StrivePD, we have 11,000 people in the United States, in all different states, and in Canada. So we cannot be working under our medical license. But this is more for educating the user, helping them with StrivePD, supporting, motivating, and helping them come up with topics to talk to their physician about, maybe pointing out certain things in their data that they should bring up to their clinician, helping them to understand their data better. But we will not be, prescribing medication or telling them you should take your medication at this time versus this time. We cannot do that. We cannot practice that medicine, but we are kind of like, just that support for you for being able to answer your questions, educate, almost like a support group individual, that you can, instead of talking to your friends in support group, you can contact your coach and say, hey, I have a question about, Rock City boxing, or I have a question about, the side effect of a medication. Does this happen? And we're there to educate.
Yeah. So for example, if, we know a lot of patients struggle with constipation, so we can't tell you that we're going to prescribe you Linzess for your constipation, but we can tell you, more hydration, more exercise. We can let you know that there are medications for constipation out there if you'd like to talk with your doctor. And we can tell you, maybe taking some Miralax or Metamucil that's over the counter could be beneficial. But you can think of it like if you go on the Brian Grant Foundation and you're looking at these resources and there's lots of words and there's lots of pages, we can synthesize and put a human touch to that information so that you can understand it and ask questions about it.
And another point is your clinicians are very busy and they, I know Amanda knows this as well. Sometimes you have 15 minutes to talk to your patients, unfortunately, in our healthcare system today. So you may not be able to get all of your answers from your clinician at that time, just about general topics having to do with Parkinson's. So we're here as that extra support of, okay, I want to learn more about this topic. Let me contact my StrivePD coach and find out more information.
So just so that we have to wrap up, the last thing one we just got asked is the cost. So I think you mentioned $600 a year for the StrivePD Guardian. Is there a monthly rate? Can you as well?
Yeah, so it'll be $50 a month.
Okay.
And I believe we can do it in 3-month buckets. So again, this hasn't launched. So, if this is something that, you have to pay for yearly or you can do in 3-month buckets and you really want that monthly option, we are looking at all angles to make sure that we can provide this to as many people as possible. So yes, it would be $50 a month.
So, because I think we have a lot of people interested in signing up. So the website to learn more is, can you remind us one more time?
Sure. It's strivepd.com. And once we go live in March, you can sign up for Guardian and we can get you started.
Okay, great. So visit strivepd.com so that you can also download the app. If you're on Apple, you can go to the App Store. You can download StrivePD there. You can learn more and download by going to strivepd.com. Next month, StrivePD Guardian launches. So if you're interested in that feature, check back in March when the launch. We can also email everyone afterward. And then, I'm sorry, I thought I placed the link there, but I only sent it to the panelists. There's the link, strivepd.com. And finally, just letting everybody know we did record this session. It will be on our website later today. We will also email it to everybody who attended and registered for the webinar. So stay tuned on that. So if you want to rewatch it, go back to listen to any other information, we can, you will get that from us later today. So with that, thank you so much for joining us, Brianna and Amanda. I really appreciate your taking the time to talk to us about this awesome and free tool. So thank you guys so much.
Thank you. It was our pleasure.
Take care.
Bye-bye.